Thank you, Deputy Speaker. I'm speaking today in support of the National Health Amendment Cheaper Medicines Bill 2025. This is a bill that aims to ease the financial burden on Australians and improve access to essential medicines, which I commend. The bill also implements a key pre-election promise from the Labor Party, which was matched by the Coalition. So we're unlikely to see much opposition to this bill from the Coalition. This election promise matching is good for swift outcomes, but maybe more broadly could be bad for critical analysis of new laws. That said, reducing the PBS co-payment from $31.60 to $25 for patients with a concession card is a meaningful step. For many Australians, particularly those managing chronic conditions or supporting families, this change will result in hundreds of dollars in annual savings. It's estimated to save patients nearly $800 million over 4 years, which is a big number with a huge impact on individuals. Lower-cost medicines means fewer skipped doses, fewer delayed treatments and fewer people forced to choose between their health and their household budget. The bill also expands access to vital treatments, covering conditions like breast cancer, endometriosis, menopause and rare diseases. These are not fringe issues. They affect thousands of Australians, and this legislation will make a real difference in their lives. But while I support this bill, I do so with a clear understanding of its limitations. This is a step in the right direction, but there are still plenty of people struggling with the cost of medicines. The general PBS safety net remains high, requiring nearly $1,700 in annual spending before additional subsidies or support apply. And that's a threshold far above what we see in countries like New Zealand or the UK, and it leaves many low-income patients still vulnerable to high out-of-pocket expenses. The bill's impact assessment might have benefited from broader stakeholder consultation. The Office of Impact Analysis noted that while the assessment was adequate, it lacked a detailed implementation plan and input from some key groups. And thirdly, we must remember that affordability is only one part of the equation. Medication adherence is influenced by many factors: access to pharmacies, health literacy and continuity of care. And if we truly want to improve health outcomes, we must continue to address those systemic challenges. But it is a step in the right direction. It reflects a commitment to equity, to preventative care and to easing the burden on everyday Australians. On a related issue, I'm frequently contacted by constituents about vital medicines they require that are not listed on the PBS. And this includes medication for heart disease, cancer treatment and menopause management. And a 2020 House Committee inquiry showed that Australia is starting to lag behind in access to new medicines. It takes an average 466 days from when the Therapeutic Goods Association says a new medicine is safe and when it's actually added to the PBS. The assessment process for new medications is outdated. It's 30 years old and it doesn't consider many broader benefits like keeping people out of hospital or in school or longer-term benefits. It could involve patients earlier and more deeply to ensure that the full patient experience is considered. And I'm aware that Minister Butler has committed to reform and to implementing the 50 recommendations that came out of the Health Technology Assessment. And I appreciate that commitment, but note that it's coming up to 3 years since those recommendations were made, and it's time to get on with it. Now, just before speaking, I saw that there's an amendment put by the member for Lindsay on this legislation, and I will be supporting that amendment, the first half of which really draws attention to this delay on implementing the health technology review assessment. I will be supporting that amendment, even though I don't really agree with the second half of it, which says that the national interest would be progressed by a meeting between the Prime Minister and Donald Trump. I'm not convinced that a face-to-face meeting with the US President would actually further Australia's interest in relation to pharmaceuticals or other issues based on what we've seen from other meetings. And it is a bit of a gratuitous attack line of the week, but I think the member makes a really good point in the first half of that amendment that we do need to get on with implementing the 50 recommendations that came out of the Health Technology Assessment. So in conclusion, I support this bill and the amendment, and I urge the government to treat it as part of broader ongoing reform of our healthcare system and to focus on timely access to new medicines as a high priority. We need to continue to build a health system where no one's left behind and where access to medicine and healthcare is not a privilege but a right. Thank you.